Well, hello ladies and gentlemen, my name's Julie McCrossan, and what a pleasure it is to welcome you to this webinar consultation about how to improve the radiation experience for patients and for families. And this webinar consultation is hosted by SAHMRI, the South Australian Health and Medical Research Institute, and also the Australian Bragg Centre for Proton Therapy and Research, which is being built even as we speak. My name's Julie McCrossan, and 7 years ago I was treated for stage 4 throat cancer with 30 sessions of radiation and weekly chemo. And I want to begin by acknowledging that we're broadcasting to you today on Aboriginal land. I'm in central Sydney with some wonderful people you'll meet soon, and this is the land of the Gadigal people. And I want to pay my respects to elders past and present and emerging leaders. Our purpose today in this first of 5 webinars is to seek your views. Yes, this is a sort of webinar consultation. Your views on how to improve the radiation experience for patients and families. And of course, proton therapy, which is coming to Australia, is another kind of radiation. And we're going to share those views with the Australian Bragg Centre to inform how they're going to build the internal design of their systems as well as their human systems, but we're also going to share it with the national radiation community and the cancer community generally. So you'll see, of course, the chat button. We want you to use the chat button, and right from now you can start telling us your thoughts on how to improve the radiation experience for patients and family. And we'll be sending you a written survey also a couple of days after this webinar, and we want to collect your views and we'll promote them on a special YouTube channel we're creating for these webinars, but also for your comments. Our format today is going to be a number of video visits to cancer centres that are offering both proton therapy and conventional radiotherapy. And that's to inspire you and get you thinking about how some people are improving the patient and family experience. And we'll also be meeting some special guests and hearing their comments. Associate Professor Sandra Turner, who's here in the room with me now, a radiation oncologist from Crown Princess Mary Cancer Centre in Westmead in Sydney. Enormously pleased to also have Professor Phyllis Butow, a cancer researcher from the University of Sydney, who's done lots and lots of work about the cancer experience for patients and family. Later on we'll meet Vicki Bedford, whose daughter was treated with proton therapy in the United States at MD Anderson. And we've got Associate Professor Peter Garaski, as well, a radiation oncologist from the Royal Adelaide, and many others, including 2 of the architects who are working. The architects are from Woods Bagot, and they're working on this new Australian Bragg Centre. So let's begin. It's my pleasure to introduce the Executive Director of SAHMRI, the South Australian Health and Medical Research Institute, Professor Steve Wesselingh.
Welcome to this webinar series where we're going to focus on how to improve the radiation experience for patients and their families. I'm Steve Wesselingh. I'm the Executive Director of SAHMRI, and SAHMRI is one of the organisations that's working in a partnership to bring proton therapy to Australia and to South Australia. The Australian Bragg Centre for Proton Therapy and Research will be the first proton therapy unit in Australia and the most advanced proton therapy unit in the Southern Hemisphere. SAHMRI, the federal government, the South Australian state government, the project manager CNG and the builder Lendlease are all working together to create this proton therapy centre. This is really important because what it will do will enable Australian patients to get this life-saving treatment in Australia rather than having to travel overseas. This treatment is particularly important for children where it can target tumours in really difficult areas and not damage surrounding tissue. Construction of the Australian Bragg Centre has begun. It's designing a safe, welcoming and comfortable environment for patients who come to the Bragg Centre for proton therapy is more than just building a building. That's why we're talking to you. Cancer survivors, families, patients, clinicians, we know that you understand what's needed. With your reflections and experience, we can create a truly outstanding proton therapy centre that is comfortable and safe. And not only that, we can share those findings and those developments with the broader community. Thank you for taking the time to be part of this conversation, for giving up your time to help us improve the experience for patients and their families.
And I want to thank Professor Steve Wesselingh for supporting this series of webinars looking at how to improve the patient and family experience. We're going to have another one next week, and we'll also have 3 or 4 more early on in 2021. Well, I'm so excited now because we're going to travel to Denmark to the Danish Centre for Particle Therapy in a town or city called Aarhus. And we're going to talk to Dr. Morten Hoyer, who's the Medical Director, Radiation Oncology. Well, Morten, welcome to this discussion about how to improve the radiation experience for patients and families. I'm so excited to be speaking to you in Denmark, but your coffee cup, can you just show it to us?
Yeah, right. This is the one.
And so where did you get that coffee cup?
I got it from a conference at the Wollongong University in Australia. It's my favorite cup.
Well, we're thrilled that you're using an Australian cup. Look, just before we hear about your centre, the Danish Centre for Particle Therapy at Aarhus University Hospital, in a nutshell, what is proton therapy?
Proton therapy is a highly specialized radiation therapy. It's radiation with small particles, the smallest that we have, protons. And where we actually accelerate protons up to a very high energy level, and then we can actually use it for radiation therapy. What is so good about the particles or the protons is that we can irradiate a tumor to a high dose without spreading out dose to the surrounding normal tissues, which means that we can have a high cure rate and the lowest possible risk of side effects.
And what sort of patients, what groups of patients do you mostly see where you're working in Denmark?
We treat children with cancer. And the reason why we treat the children is that they have a very high risk of very severe side effects. And also they have a risk of having a secondary cancer due to the radiation exposure. Therefore, we have to limit this radiation exposure to the body of the child, and this we can actually do with protons. Then we treat adult patients with brain tumors, some patients with breast cancer, some patients with esophageal cancer, head and neck cancer, and also other types of cancer.
Okay, well look, let's turn now to our primary focus, which is how do we improve the experience of radiation for patients and families. And I want to focus particularly on how you've designed the Danish Centre for Particle Therapy. So as I walk in, what am I seeing? Describe what I'm seeing and why you've designed it like that.
First of all, I mean, that was very important for us to design it in a way that it should be for the patient and not for the personnel there. So first of all, we wanted it to be we wanted light to come into the building. And for that, we have a very big atrium. Actually, you enter the building into this big atrium where there's a waiting area. We also found that it should be very important that we should have an easy wayfinding, so you can find your way directly from this waiting area into the treatment room. Also, we had a very creative architect to do the design of the building, and for that reason, I mean, we have a very nice building with I mean, we have wooden coverage of the walls, and we have a very large garden. Actually, it's a jungle. We don't have jungles here in Denmark, so we need to make them artificially. And it's a beautiful room, and it's a very nice room to work in. It's also very nice for the patients to stay there.
And what was the thinking behind having a lot of light and wood and a jungle? What were you hoping to achieve in terms of the patient and family experience?
First of all, I think it's extremely important that we appear professional. It should be quality. It should actually give you an impression of quality. Second, it should actually be a peaceful atmosphere. We know that a lot of our patients, they are scared of what is going to do, what we are going to do with them. I mean, what kind of experience will they have? And for that we have to make a very nice and quiet and atmosphere, and I think we got it.
In the waiting area, it's a very special part of your centre, isn't it? And it allows both mingling and seclusion. Could you explain that?
I mean, we know that patients often want to sit and talk because they can tell about their experience. I mean, that they have had. I mean, earlier during the course of the disease and during the diagnosis and so on. So they need to have someone to talk to, and very often they can find this by chatting with other patients. So we try to kind of make small groups where they can sit and talk together. Right now, during the corona, I mean, we have to separate, and we do that, and the patients, they do it as well. But I mean, in the normal days, they can really have a good talk to some of the patients, and also to the person. And we have these very nice small groups where they can do that. We have very modern Scandinavian design of the furniture. Actually, I was very skeptical when I saw it for the first time, but now I can see it works.
Why were you skeptical, and what do you mean it works?
Because I thought that the patient would prefer to have something which was very comfortable to sit in, a comfortable chair. But actually, most of them, they actually want to sit in a niche instead of, because that's what they want to do, sit there and enjoy themselves with their cell phone or maybe a book or something to read in. It actually works.
And is part of the idea that it doesn't look like a hospital?
That was part of the idea, yes. We didn't want to look kind of a clinical place. I'm in a hospital. So it's actually a very nice, it looks more like a town hall or something.
And you mentioned earlier that you went for Easy Wayfinder. Can you explain what that means and then how you've achieved it? Give us a visual image of how you make it easy to find things at your cancer centre.
There should be straight lines between the entrance, the waiting area, and straight lines again between the waiting area and the treatment room. And you should be easy to find. We have 3 different treatment rooms. You should be easy to find room number 1, 2, and 3. And this is actually the way it works.
And the bunkers, what have you done? Have you done something inside the bunkers? Bunkers, of course, is where you get your radiation therapy, your proton therapy.
Because it's actually a very heavy construction. There's a lot of concrete, and it's very difficult to make anything, nice there. But we tried to do it with colors, to have a lot of kind of bright colors. And we had an artist to do it for us, and I think we succeeded as well.
Because you deal a lot with children, I think you have a school. Why is it important to have educational connection within a place like the Danish Centre for Particle Therapy?
2/3 of our patients have to stay here in Aarhus because of the geography. I mean, we are a small country, but even here in Denmark, I mean, travel can be too long for commuting from and back for your daily treatment. And usually you should have treatment over something like 30 treatments over 6 weeks. So we need for the children to have a school, a teacher, and we have that as well here.
And you provide accommodation, and I think you've got choices, haven't you? You've got accommodation at the hospital and in the town. Why that choice? Why was that important?
Most of our patients, they want to stay here close to the hospital, where they can kind of feel safe, and they can have easy access to if they need help. So we have a kind of apart hotel apartment hotel where they can have a small apartment where they can stay. They can do their own cooking and they can do shopping in a close by supermarket, and so they can live out here. There's a light train going directly into the city center. However, we also have some young patients who wants to stay in the city instead of staying out here, because this is in the outskirts of Aarhus. So we have these two choices for our patients. Then we have for the children as well a family house.
Okay, so you've really got options. You're offering options. That's what I'm hearing. Let's turn to the workforce, because as I understand it, you feel strongly that the Danish Centre for Particle Therapy, we recruit the right staff. Now, one of the audiences for our conversation is the Australian Bragg Centre for Proton Therapy and Research, and they are building it literally now from the ground up. So what is your recommendation around recruitment of staff and why that's so important for the patient and family experience?
Well, the very beautiful thing by starting up a center from scratch, from the very, basic, is that you can choose your staff, you can choose everything from the very beginning. So we are so fortunate right now to have a very young, enthusiastic staff, people with ideas, people with a lot of energy, and very good people. So I think it's very important. Of course, we need someone who is trained in radiation oncology and in proton therapy. That is very important. But it's also extremely important to have someone who can work together, work in a team. And this is what we've got.
And how do you recruit for that culture, to nurture and sustain that culture? That can't always be easy.
Yeah. One of our primary goals was to kind of recruit from all over the country, not only from the neighborhood here and from the neighbor radiation therapy department. So that was kind of to get people from all corners of the country. And then to find people with different kind of, all different qualities and also competences, and of course people who really could work together and people who could actually see the needs for the patients and can see the patient as the one who should be in the center of everything.
Because that's your philosophy, isn't it? The patient at the centre of everything. Just very quickly, I'd love to get a sense of some of your system issues. And you've developed what you call a package of care within a day. I think it's even a 4-hour day. Just in a nutshell, what is that and why is that important for your vision of giving the patient and family the best experience?
What we found was that we should really make this kind of in patient-friendly way. And patients, they don't want to come to travel from and back several times for the kind of preparation of the treatment. They want to have it in a single day. So we made a package for the patient. So this means that we will see the patient in the morning. So they have to arrive here early in the morning. And then we can actually do all the preparation. The patient will need kind of often a mask system for immobilization. And we will do that. Then after that, we can do a CT scan, an MRI scan, even a PET scan. And we can have this within most of the patients within 4 hours. So it's a full package they can have, and then they can travel back. We need something like 6 work days to prepare the treatment, to do all the quality assurance that we need so that we can start treatment on day number 6. This is the fastest possible way of doing it.
So that's a real system commitment to timeliness. And how does that make a difference for the patient and the family?
First of all, the patients wants to get started. I mean, they have been under a diagnostic kind of pathway. I mean, they have maybe waited for pathology for some time. They needed an additional scans and so on. So they really want to get started. And I think that's very important. It's important for the treatment of the patient, for the cure, but it's also important for the patients kind of, they are upset, of course, by the diagnosis, and they want to get started, and they should get started as early as possible.
And when you have that 4-hour package, are there key people in the team that are going to look after them that you try to introduce them to? Is there a personal dimension as well as a speedy clinical process?
Yes, we do have a kind of a patient-responsible team, as we call it. It's a physician, it's a radiation technologist, a nurse, and even a radiographer who can actually be specific for the patient. So we all know that we are responsible for the planning of this patient, and we also see the patient on the ways during the course of the treatment. Maybe for some of them it's once a week, for some of them it's once every 14 days. So the patient will see the same team from day to day under the treatment, and also during the consultations.
You mentioned the mask, the immobilisation mask. I like to call it a safety mask. And as you know, a proportion of patients find that a challenging experience, whether it's radiation therapy or proton therapy. Do you have systems for identifying patients who may be struggling and offering them assistance either in advance or during treatment? How are you managing the so-called mask anxiety?
Yes, it's an important issue, and we try to talk to the patient, and we try to get the right impression of the patients to see if the patients need any medicamentation to kind of feel more safe, and for some patients will need it, other patients they don't need it. Maybe some patients need it for the first treatment, the first 2 treatments, and then they can actually stay without. So it's important to find the patients that actually need some sedation, and we can do that.
And whose job is it to make that assessment?
It's important. It's the whole team. It's often it's the physician when we have the first consultation that we can actually identify a patient who will need some tranquilizer. Maybe it's the nurse who talks to the patient afterwards. Maybe it's the radiographer who will make the CT scan. So they can come to me and say, well, the patient you just talked to, he will need something to calm him down. And so we will do it.
Just before I turn finally to the Danish system, because I think you've created a model that you're very proud of, and I'd love to conclude with that. But, we began our conversation with the discussion of entering a wood-panelled, light-filled jungle and how important that was. And then we've gone on to these human issues of staff recruitment and systems. In your mind, what is most important in terms of improving the patient and family experience? Is it the designs of the building and the layout and the colour and the furniture, or is it the human factors and the clinical systems?
My own impression is that it's a human factor that counts over everything else. But you should never, neglect that there's also a factor of the building and all the equipment that should be as friendly as possible. But it's very important to play on all these horses when we're building up a centre.
I understand that at the heart of the Danish model is this sense that the whole system distributes ownership across your referring centres and to you, the Proton Therapy Centre or Particle Therapy Centre. How do you gain that group ownership?
Well, we decided early on that we should actually distribute the competences and the ownership of the centre and the responsibility of the centre to our colleagues in the radiation oncology centres in the country. There's 7 of them, because these are actually the ones that refer patients to us. We did it in the way that we asked them to define which patients should be referred to our centers for this very highly specialized treatment, and which patient could actually be treated in their own departments or centers with the conventional radiation therapy, which is also a very modern and a very good treatment. So we had this kind of discussion going on, and some of the patients that we actually had to test by simulating the conventional radiation therapy and the highly specialized treatment that you can give here and see which is the best. And they can actually do it. And most of our patients treated here in Aarhus, they have their treatment as part of what we call a clinical trial. And the owners of their clinical trials are actually the clinicians in the referring radiation therapy centers in the country. And we find this is extremely important for the sustainability of referral of patients to our center. And I think it's important that we are not just the ones owning this place and patients can be referred to us, then we'll treat them. It should be done in the close collaboration with our colleagues.
And part of your commitment too is to have multidisciplinary team assessment for all or most tumour types?
Yeah, we do. We have more than 20 different multidisciplinary kind of organizations. There's one for each of the large tumor sites, such as head and neck cancer, brain tumor, children, etc., etc. And they were the ones that actually defined the patients that should be referred to us, patients that should have what we call the comparative treatment plan for selection to this place. And they're also the one kind of looking over us and overseeing what we are doing.
Has there been a patient or family involvement in any of the things you've described in developing these systems or giving you feedback on how it's going? Any sort of, interaction with the patients and families?
Yes, and we want to do it even more than we do it, but we have done it so far. But we had patients during the design of this building to kind of tell us what is important for them, what was important for them, and what kind of priorities should we make in the design of the building, and also in the way that we set up our workflow with in the preparation of the treatment and also in the daily treatments.
I'm a head and neck cancer patient survivor 7 years ago with 30 sessions of radiation and weekly chemo. You mentioned you do see head and neck cancer patients. In what circumstances is it useful for head and neck cancer patients to get proton therapy?
It's actually very useful, at least, but this is what we believe right now, for something between 1/3 and half of the patients, and we actually have to test the patients and see which treatment is the best for the individual patient. And for some patients, we can actually spare a lot of the neck, of the swallowing structures, so that there will be less side effects, less effects during the course of the treatment. And also long-term effects. Some patients actually suffer from very severe side effects like serostomia and swallowing problems.
Dry mouth and swallowing, yes.
Exactly, yes.
Well, look, just finally, Morten, there are people watching this conversation who are, even as we speak, making decisions about the new Australian Bragg Centre for Proton Therapy and Research, including the internal design and the human systems. One bit of advice based on your experience in Denmark, what would it be to those teams working it all out?
Spend a lot of time in preparing this. I mean, it's relatively easy to build a proton center, but the organization that should be there and the system in referring of patients, the education of your colleagues in the clinics outside, the ones that should refer patients to you, and also take care of your patients after the treatment. It should all be organized, and that should be done ahead of time, before the proton center is completed and can start operation.
Well, Dr. Morten Høyer, thank you so much for your time and for joining us through cyberspace from Denmark. It's been an absolute delight to speak to you, sir.
Thank you very much.
And I can't be the only person who's just watched that discussion who thinks as soon as we can get on aeroplanes again, we must go to Denmark and meet Morten and see his centre. My name's Julie McCrossan, if you've just joined us, and I just want to let you know that we are going to be setting up a YouTube channel, and today's webinar and the future webinars we're doing in this series on how to improve the radiation experience for patients and families will be on that YouTube channel. I know there's quite a bit of disruption in different parts of Australia as we speak in relation to COVID-19. But look, it's my great pleasure now to invite three people to join us live. Vicki Bedford, who's the mother of a child that received proton therapy treatment at MD Anderson in the United States, and a welcome. We'll give a wave and a clap in the traditional manner. I'd also like to welcome Associate Professor Sandra Turner, who's a radiation oncologist at Crown Princess Mary Cancer Centre in Westmead in Sydney, and welcome. Everyone learned to do this because people need warmth even in cyberspace. And Professor Phyllis Butow, who knows all about warmth because she's from the School of Psychology at the University of Sydney and someone who's done a lot of research in this area. So welcome to you all. Thank you. Look, Vicki, just very briefly, because I want to get your input into the future of radiation therapy and proton therapy and the experience, but what was your daughter treated for and how old was she and how is she now?
Julie, thanks for having me. Well, just briefly, my daughter was 2 years old when she was diagnosed with a solid tumor in her spinal cord, and it was a Ewing sarcoma. She was treated with 9 months of chemotherapy radiation, and she did 24 rounds of proton therapy radiation over the course of 5 weeks. And she's doing much better now. She's 14, and she's a lively, really well-rounded child. Learning disabilities have been pretty much nil. Physically, she has some damage to the structure, but mostly from the surgery. And overall, the radiation did not do the type of damage that traditional radiation, we have been told, would have.
And turning to the actual experience, what helped you the most? I realise this is in the past and MD Anderson may indeed have new systems now, but with your memory, what were the 2 or 3 things that helped you and your daughter and your family at that time?
One of the big things that kind of go along with the Danish center, the lounge area was a really big thing for us. I happened to have a newborn at the time, so I was also nursing, and having some secluded but not fully private areas where I could have some privacy, nice couches to sit and relax in between waiting for her to go in, waiting for recovery. That was a really big thing. There was a lot of natural light, which was also really helpful for us. Couches, they had a book exchange, like a little library. You could read books because sometimes we'd be there for a couple of hours. So that the Danish Center really picked up on a lot of those design techniques that were really nice. One thing we really liked, because my daughter did have to be sedated every single day because of her age, they had these warming beds that were just amazing. They had almost like a little blow dryer that was blowing hot air into this really tightly wrapped little cocoon of a bed, and that really helped her come out of sedation a lot more gently. And because it's very cold within the bunker, as you would know, all that air conditioned air, it makes them really chilly. And then as they come out, just to be warm, it's almost like a little warm hug that they got. So that was really, really nice. And again, with the Danish thing, they really picked up on the staff. The staff was a big deal for us. The staff actually learned a song for Zoe that they would sing every day, and as we danced our way through to the bunker. And that staff rapport that we were able to build was really important for us to be able to feel comfortable for both myself and for my daughter.
As you've emphasised there, Morten Høyer from Denmark, when I gave him the choice between obviously the enormous amount of work they'd put into the design and so on and the human factor, he went for the human factor. What was it about the staff's relationship to you? And I think your father, from memory, was also critical, or it may have been your father-in-law. What was it about the way the staff dealt with you and your family and your daughter? Just more specifically, what were you looking for that really helped?
I think they really took us each individually and looked at what we needed as individuals within the situation. It was my father-in-law. He's a rocket scientist, so he really needed to understand the analytical piece. And they actually took him downstairs to the basement and showed him the cyclotron. For him, that's what he needed to really understand the inner workings and what was actually happening to his granddaughter. For me, I needed to know that somebody enough to learn the words to a silly song and to do a little dance break for us to make my daughter smile and be happy as she's pretty terrified. And for my daughter, they signed the molds. So she didn't have a mask. She had these molds that they used to target the actual tumor. And they signed those. And even today, it seems silly to have like a keepsake from such a really bad situation, but it was a good memory. And sometimes you need those good memories to be created within a really bad situation to have something else to look at rather than it all was dark time for us.
I'm going to come back to you shortly to just ask you about Cancer Voices South Australia, because Vicki is very involved in assisting others. But I want to invite Associate Professor Sandra Turner to the conversation, because Sandra, you're a radiation oncologist. You're dealing with patients all the time. We've got Professor Phyllis Butow sitting beside you. What struck you in the Danish experience? The 2 or 3 things that were thought-provoking you think we need to think about here in Australia?
I think the first thing that struck me was that we pay a lot of lip service to making our processes and the care for patients patient-focused. But to actually put that into practice is another thing, again, when we're dealing with health systems and some potentially hierarchical and quite stuffy traditional processes. And I think what Morten was explaining was something that really put the patient at the centre of every aspect. And that he was willing to actually adapt and change, realising that some of his ideas and concepts, for instance, what he thought might be the best arrangement for the waiting room or the chairs, actually, when you consulted patients and others that had more expertise, and doctors sometimes are not great at accepting that others have more expertise, actually, he realised that had been the right decision. So his willingness to really put the patient at the centre of every aspect, from the building to the processes and systems, I think was the thing that really jumped out most to me.
Is there something else? There's one thing I'd like to ask you about, but do you have another issue you'd like to raise?
And the other thing I think was that, again, we talk a lot about collaboration and making sure that we're managing a patient in concert with the other people and groups that are important to them, not only their family and immediate supports, but also in the places that they've come from, the doctors and other care team members that have initially got to know the patient. The decision about whether people are suitable or more suitable for proton therapy was made collaboratively. The share of the care and the continuity was also made collaboratively. And I think, that's something that we're often envious of Denmark, because they are a small country. A lot of what they do is very nationalised. And I think in Australia we can take a lot of lessons from that. We're a very large country, very spread out. We have a lot more individual radiation oncology centres. So if we can go towards that idea of really sharing the care of patients with patients, and to really focus on what's best with them between referring centres, then we'll be doing a really good job.
Look, Sandra Turner, you've gone to the nub of what interests me as a head and neck cancer patient. Once the Australian Bragg Centre for Proton Therapy and Research is built, I want to feel confident if I am a patient with head and neck cancer, for example, that all the different cancer centres that offer radiation therapy around Australia have got together and worked out collaboratively a system where I'll be assessed completely open-mindedly about whether conventional radiation therapy or proton therapy is best for me, that you'll all know how to do that, whether I'm in Tasmania, Western Australia, Brisbane or Sydney or Melbourne, wherever, and that if proton therapy is best for me, you'll get me off to Adelaide. And that involves a lot of mutual respect and mutual communication and trust. How do you think your mob are going to go?
Yeah, well, I'd like to reassure you and others that process is being started a very long time ago in terms of people that have interest and expertise in protons, particularly people at the moment looking after patients who are in childhood or adolescence. So it's not like it's suddenly, been plonked in South Australia and nobody else knew about it, 5 minutes ago. There's been a lot of collaboration and networking and sharing of experience already, and that I've no doubt will continue to be a focus as the service is rolled out.
Thanks so much, Sandra. And now Phyllis Butow, from the point of view of someone who's done research in psychology, what are the 2 or 3 things you're thinking about from what you've seen in Denmark?
Well, like Sandra, I was also really impressed with the commitment to patient-centred care. That showed itself in so many ways. For example, the commitment to having a team of people that were dedicated to one patient. And we know so well that seeing the same people throughout the journey builds trust and an ability to communicate when you do feel anxious or distressed with a group of people that you know well. And it sounds like a simple thing to do, but I know it's not that simple to achieve. So I think that was an example of real dedication. And I guess another thing that really impressed me was that they put effort into finding staff that all shared the same vision of patient-centred care. Because again, we know that if you're going to achieve a particular vision or way of doing something that requires people to work together, you need a team of people who all really share that vision. And they had worked really hard to do that. So I guess apart from all the building aspects, which of course are important, those people factors had really been thought about and carefully planned.
Look, thank you so much, Phyllis, and Sandra and Phyllis will come back to us again at the end, but I'd just like to come back to Vicki Bedford for a moment, if I may, the mother of a child treated at MD Anderson with proton therapy some years ago. Vicki, if you could turn on your microphone and join us again. What I want to say to you is, you're from Cancer Voices South Australia. Just tell us, what is Cancer Voices South Australia all about? How do you work for patients and families?
So Cancer Voices South Australia is one branch. We also have some in New South Wales as well, and other states. What we do is we're a volunteer organization, and we're just there to raise awareness for multiple cancers, so every type of cancer, and we're just trying to help bring that patient experience into all aspects of the treatment, from the clinicians to the research, and just really get the patient voice involved, just like what you're doing here, Julie. This is really important to us to get it from the very beginning of the design stages rather than after it's already been done, just to hear our piece. Our experiences, our lived experiences, are a big piece of how to do it better later on. Like Dr. Morten was amazing when he said, that multi-D team, that is a huge piece for us. A lot of us don't have just one doctor, as you would know. And to have them, especially if we have the center in Adelaide, we're going to have people from interstate, potentially international visitors as well using this. We need to make sure that we have those lines of communication open, not just to the other clinicians, but to those patients as well, to make sure they understand why this is the best treatment for them. So Cancer Voices is here to help spread that word.
Stay with us, because we'll come back to you after our next adventure, because, ladies and gentlemen, we're travelling now to Melbourne, to the Peter MacCallum Cancer Centre, to see what they're doing to improve the patient and family experience of radiation therapy with amazing innovation and creativity. Well, let's start with the so-called children's videos. This is all about how to improve the radiation experience for patients and families. Tell us about the videos you make. What's their purpose? How are the young people involved? And how you think it improves the experience for them, but also for their family?
Sure, thanks, Julie. So, most simply, I guess there's a few aims of the project, but if we think about it, it's, just to have a bit of fun on the day, first and foremost, to break away from, I guess, the general day of treatment. And I think it gives children anywhere from, they could be a superhero, they could be a princess, they could be a music star, or it could even be a basic documentary. But it provides an avenue for them to express themselves in a way sometimes they can't, especially with the younger patients. They have a lot of fun with it. Sometimes they take on the persona, say, of a superhero, and it could even help them with the treatment quite substantially. So we have quite a broad range of, I guess, videos we make, and
And you talk about fun. Is this work you're doing with these marvellous videos more than distraction? Do you see it as more than that when we speak in terms of improving the patient experience?
Yeah, absolutely. Look, I think it's different for every child and family. So, for some children, it's a way to remove the stigmatism associated with cancer treatment. So they can, show that to their friends and family, and sometimes, show it in a fun and interactive way. And it kind of breaks away that barrier, which is, really great. It also provides families, generally to show them what's happening, and sometimes a lasting memory, of a time of that treatment. So I think it certainly has a lot of benefits, besides, having some fun, running around sometimes and creating some fun videos. So, and provides an avenue for a lot of kids to tell their stories, a lot of the oldest children as well. So, yeah.
Radiation therapy can be quite a daunting experience, not just for children, but anyone who's undergoing it, as you're well aware. So we were very mindful of that and wanted to try and provide an experience that was going to make it a little bit easier for our children or our paediatric patients to get through. There was an idea that we put together with some colleagues up at the Murdoch Children's Research Institute, and developed a research protocol on the back of a virtual reality experience that we developed, which takes the child through, not only the child but also their families and their friends as well. It takes them through the radiotherapy experience prior to it actually occurring. So for those of you who aren't aware, radiotherapy is a two-part process. It's the radiotherapy simulation, which quite often involves a mask getting made, which for anyone can be quite a daunting experience. And then there's the radiotherapy, which is a series of treatments over anywhere up to sort of 7 weeks of radiation. So the virtual reality experience is filmed through the eyes of a child. So the child puts the goggles on, they can actually watch the child go through the radiation therapy. We've also filmed it so that it can be visualised as if the child is actually having the treatment themselves or having the mask made themselves, so that when they actually go ahead and have the procedure done, it is hoped that they'll have a better understanding of what's going to happen, in the hope that then it would then lead to reduced anxiety and improved health literacy about what's going to happen, so that they're a little bit more at ease going into their treatment.
Is part of the purpose to reduce the need for sedation?
Yeah, definitely. That was one of the things we were looking at doing. Obviously, younger children find it more anxiety provoking, I guess, this procedure. So that was very much part of the initial, brief for this project, to try and reduce that need. And it is something that we've been looking at as part of our research project as well, to try and negate the need for general anaesthesia as part of their treatment.
And I just want to let you know that both Daniel and Nigel will be returning later in our webinar series with a more comprehensive description of just the most fascinating work they're doing at the Peter MacCallum Cancer Centre in Radiation to improve the patient and family experience. And if you've just joined us, a reminder, you can put your comments and thoughts right now through the chat function. Please use chat. Tell us anything you're seeing at Peter MacCallum or earlier in Denmark that you think was of value, something we should think about here in Australia, or your own suggestions on how we can improve the patient and family experience of radiation. But what we're going to do now is go to another part of the Peter MacCallum Cancer Centre in Melbourne, and we're going to meet a young cancer survivor who co-chairs the Youth Cancer Action Board for Victoria and Tasmania. And first of all, we're going to meet the team leader of a statewide service for cancer patients aged 15 to 25. Well, look, it's my great pleasure now to welcome Ilana Berger, social worker, clinical team leader at On Track at the Peter MacCallum Cancer Centre in Melbourne. Welcome to our webinar on how to improve the radiation experience for patients and families. Just in a nutshell, what's your job there and where are you?
So I'm sitting right here in our Youth Cancer Centre, which is on level 1 in the Peter MacCallum Cancer Centre building. My role is I'm a social worker by training and I'm the clinical team leader with the program, and essentially I provide a range of services to young people between the ages of 15 and 25 coming through the hospital for treatment, but actually we have a statewide remit, so I see other young people outside of this hospital per se. I also do a number of other things, so quite a lot of education and training to healthcare professionals, some research, and some capacity building, and also secondary consultations, so providing advice and guidance to other people looking after young people out there in the community. So a bit of a broad role. And
you have worked at Peter Mac for 18 years.
I have, actually, and 25 years in the field, so feeling a bit old, Julie.
So just before we go to what you're doing there specifically to improve the experience, radiation experience for patients and families, you believe that the 15 to 25-year-old age group is a critically different group. Why is it important to see them as a specific group, and what are the key challenges they face that we need to address as we care for them?
So I definitely see them as a very unique group. That's a really good question. I think when we think about young people, we have to think about all the other challenges that the young person faces in their lives, even before we layer that with a cancer experience. So young people have a lot of things going on. They're at school, they're at uni, they're just embarking on their employment pathway. They're celebrating their rites of passage and going through a whole range of milestones in their life. And then I think we layer that with a cancer experience, and that can really exacerbate what we would say is normal developmental trajectories. And by the same token, the cancer experience can actually have an impact on the young person's normal development as well. So I think it's important when we're looking after young people that we really focus on them as young people first and foremost, even before we begin to think about the impact that treatment might have.
Yes, I think you call it the developmental lens, that when you're creating a room for recreation or treatment, or whether you're developing a service system, you look through a developmental lens. And part of that, of course, is the relationship with their parents and family. So just in a nutshell, what is the challenge there? Because on the one hand, between 15 and 25 years old, you're normally separating, and yet the family is a very protective factor when you're sick.
That's exactly right. So, for many of the young people we see, they've, just embarked on moving out of home, living independently or living with mates in a share situation. And then they become sick. And for many of them, they have to move back into the family home. They lose their independence. And in fact, in some instances, we have parents who have to very intimately begin to care for their 17, 18, up to 25-year-old, which is, really difficult. And so whilst we want to work with the young person to promote their independence and to make sure that we help them attain those normal developmental milestones, we also recognise that for many young people, their parents are still, as you said, Julie, their primary protective factors. So it's how do we balance supporting parents but at the same time promote the young person's independence. And that's a really difficult balance to often find. But when we use that developmental lens, that's what we're focusing on.
And I think we've included in our discussions how do we improve the radiation experience for patients and families. It's so critical to put the families there because radiation generally is an outpatient experience. And I think people perhaps unfamiliar with this world can forget that. But look, let's turn to the specifics of what you're doing at Peter Mac. You're in this youth cancer centre, and I've been lucky enough to be there. We're going to see images of it now. Young people were involved in co-designing that space. So what's the purpose of that space? What happens there? And why did you involve young people even in designing it?
So this is a purpose-built space which really provides young people with a youth-friendly environment within an adult hospital system. And we were very fortunate to have funding from the Sony Foundation to be able to establish this space. And really the most important thing when you're designing a space for young people is that you have the voice of young people involved in that right from the beginning, because we want to make sure that the space is responsive to the needs of the age group that it's serving. So we partnered with young people a number of years ago, and they were involved right from the beginning in both the design but also the soft furnishings, the colours on the wall, everything you see in the area. And really that was about making sure that it met their needs. And so what young people wanted was sort of a broad space where they would be able to come with their family, with their friends, and hang out while they're waiting for clinic appointments, if they're having a break from being on the ward as an inpatient. They wanted an area that was spacious enough to accommodate all of those people in their life, but also you can see some breakout pods where it was really important to them to have a quiet area where they could go to on their own and either relax and have a lie down or do some work or study. Some of the space has the ability to connect with school or uni or their workplace, because remaining engaged to what's going on outside of the space is so important for young people.
And they wanted to have, as I understand it, light and a view to be able to look out. I mean, I can see trees behind you now. Tell us about that. Why did they want that?
So absolutely. I mean, I think that young people described wanting to have a place that was like a home away from home, that didn't feel like an enclosed hospital environment. And so you can see with the windows and the view that was really important. And I guess for them it was about feeling that sense of comfort in the space that they were going to spend so much time in. And so I think when we look around here, it does feel like a home. We have a fully equipped kitchen. You kind of don't feel like you're in a hospital setting, which is exactly what they wanted to achieve.
And when I came and had a look at your space there, when I came in the front door, I looked to the left and there was this amazing big room full of beanbags and musical instruments. I think you watch movies in there. What's that room all about?
So what the young people really, spoke about in a great amount of detail was having a space where they could engage with other young people. So the purpose of that room, it's a bit of an everything room. It is an opportunity for them to come in, to hang out on the beanbags, to watch movies, to bring their mates in if they want to engage with their friends while they're having treatment. But really the focus is about fostering peer connection and peer engagement, and not only with other young people undergoing treatment, but we also know that young people want to spend time engaging with their healthy peers. And so that space provides a really lovely opportunity to be able to do that.
I see. So while young people, 15 to 25, to remind people of the age range we're talking about here, while they're having treatment at Peter Mac, they can bring their friends in. This is like their space.
Absolutely. And that's really all about youth-friendly care. That's what we need to be thinking about when we're supporting this age group.
Look, just before I leave you and we move to someone else at Peter Mac, I understand the young people too, right from the beginning, said we don't want to be with the old people. I am a cancer survivor and I was in my late 50s when I had cancer, and I had trouble being with people in their 70s and 80s. It's like we all want to be with our peers, But why was that important? What did they tell you? And I think Sony has also supported some treatment areas in Peter Mac so the young people can be away from the older people.
So I think it was important for young people to be co-located with others of the same age. And I think if you think about being 17 or 18 and being on an inpatient ward with a much older adult, not that we have any issues with older adults, I'm one of them myself, but I think for young people it is about having that connection to people of their own age, and that's about having a shared understanding of an experience, and it fosters that connection. So whilst we have these really lovely environments that cater for that age group, it's probably important to say that the wraparound services that are really youth-focused services are just as important, so that we're mindful of having that developmental lens and delivering care that's tailored to the needs of young people, including having them located with other young people as much as possible.
Well, look, just finally, we're going to meet Jess later, a young woman who's been through Peter Mac as a patient. And she's involved in sort of systemic advocacy. Just introduce us to that board that she's on and its purpose.
Yeah, so Jess is part of the Youth Cancer Action Board, which is actually the Victorian and Tasmanian Youth Cancer Action Board, which was established some years ago, back in 2010. Jess is one of our co-chairs. And really the role of the board is to inform and guide service development, to inform Peter Mac Executive, to inform government and the broader health sector around what is it that's important to young people when they're undergoing cancer treatment. So the board is made up of 12 young people and really represents that collective voice, which seeks to improve the experience of other young people undergoing treatment. So when we designed this space, the board was pivotal in working with us or partnering with us to be able to achieve what we've achieved over here.
Ilana Berger, an absolute pleasure as always to talk to a social worker in Melbourne.
Thank you for having me, Julie.
Thank you very much. Thank you.
Thank you.
Well, Jess, welcome. You're a survivor of cancer, as I am, and I think you were treated when you were about 21 and you're 27 now. Tell us about the space you're in. We've been hearing about it from Ilana Berger, the social worker there, but how would you describe that space you're in right now?
Hey Julie, golly, this space has been an absolute haven for me. I was treated at Peter Mac, and both spaces as well. We've had this amazing centre was opened in 2016, and previously I was treated at the other centre. But this space is an open plan space that is dedicated to people aged 15 to 25 to come and escape from, the noise and the other experiences out in the hospital and just have a safe place to come together. There are so many incredible spots and little locations throughout this space, and then there's also all of the services available in this space as well.
So tell me about some of the spots. If you were telling another young person who was about to start treatment at Peter Mac, what would you tell them about all the different rooms there and why they might be useful, and also the services that might be useful?
So we've got an open plan space that's got lounge areas, and then there's little nooks. So there's little study nooks, there's little sleeping nooks. I know a couple of times my dad, while I was going through treatment that was like 8 hours at some points, he would come down and have little naps in there just to sort of escape and get some time away. There's also the theatre room, there's a kitchen space. So it is amazing, and it's nice because you can see other young people going through the experience as well, and kind of understand that you're not the only one going through it, because I know as a young cancer patient you can feel so lonely and like you are the only one. So to see other young people utilising the space and knowing that you can have that opportunity to interact or just to see them is amazing. As for the services that are available, we've got psychologists here. There are the vocation officers that help with, or vocation specialists who help with work and study, to help us get back into what's important beyond just the cancer experience itself. And they continue to support not just through the treatment phase, but up to a year afterwards as well.
And do you tend to see support stuff? Like for my cancer, I saw a lot of speech pathologists because I had to learn how to speak and swallow again. Do you ever see the professionals in this area, in this set of rooms, or do you tend to see them in their professional rooms?
Bit of both. I think it's up to you where you feel comfortable and safe and what kind of conversations you're wanting to have. I definitely had some in this open space where it was just a general conversation about where I was at, especially if I wanted my family there with me. But there are also the clinical rooms that are to the side that if you want that more personal space and that confinement, it's there as well for you.
And it's so interesting that your dad had a big sleep there, because when I visited the area, there is a wonderful little, it's a little nook, as you say, with very soft lighting. And I remember at the time, I thought, oh God, I could lie down there right now and have a nap. So family are welcome. It's not only the young patient or person going through treatment.
Yeah, this is a family specialised area. This is not just for the patients themselves, but for their families to come and just have some space away. I know as a young cancer patient, often your family is there to support you. And I know that time apart was always really important for my family, just to address their emotions and their feelings as well, because they wanted to be there to support me when they were with me. So to have a space that they could also come and, I guess, address what they were going through and what they were experiencing, and not have to put on that, you know, that face and that bravery, for me was really important for them.
Look, some of the people watching these webinars, this is one of a series of looking at what people are doing to improve the experience for patients and family. Some of them are actually building a centre right now from scratch and designing the furnishings and so on, the colours. And any tips you'd offer them about how to go about doing that to get the best result for young people?
Firstly, the young person's patient voice. So actually getting young patients in and advising what they would like and what experiences they want, to have things that are going to be specific to them, have lots of, I mean, in this space alone, we've got lots of board games, we've got the incredible TV here with lots of Sony's, I think we've got like the Sony PS4 and all of their games, then we've got the theatre room as well. So there's so much technology as well that is really specific to, I guess, our generation and our age group. We, you know, love technology, we've grown up with it, so to have that in that space available for us is really important.
You know, you talk about the importance of the voice, and you're involved with something called the Youth Cancer Action Board. I think there's 12 young people on it. What do you get out of being on it? How does it help you, and how does it help other young people?
How does it help me? I think being on the Youth Cancer Action Board for me has, I think, given a purpose to going through a cancer experience. It's given me a voice and allowed me to open up and sort of speak about some of the experiences that were fantastic and things that I felt were really done well, and also advise on some of the areas that do need improvement. As far as what we do as a collective voice and as a collective board, there are 12 young people. We are from Victoria and Tasmania, and it's a completely diverse board as well. We've had so many different experiences, some people that were treated in the children's hospitals, some of them more in Peter Mac, and some of them regional as well, and then obviously some from Tasmania who have a very different experience. So we've got a lot of people with a lot of different experiences coming together to really advise, which is so important, because one voice is not enough, one experience is not enough to advise clearly. And some of the things that we have been advising on recently, this space was done by YCAB. We advised how it was going to be set up, the furnishings, the way it was designed, which was amazing. We've also advised recently on the palliative care unit. There's 2 rooms that are specific to AYA, so adolescent and young adults, who are the 15 to 25 age group, and getting those rooms set up in a way that's specific to our age group, our needs. And these spaces are bigger, there is lots of incredible technology going into them, and it's, you know, it's so family friendly and allows a young person to invite their friends, their families, their carers into that space and feel comfortable, as well as that it is on the same level as this unit here as well. So we do have the access for the services to come and see them in those rooms. So that's really amazing as far as what we've advised here. And then we've also, in the last, I think, 2 or 3 years, produced 2 amazing position statements. The first one was around how to create a safe environment for young people who identify as LGBTIQ, and create that safety and that experience for them that they feel like they are cared for and understood. The second one that was released, I think about a month ago now, is the mental health position statement, and this is around advising practitioners on how to support a young person's mental health and to treat it as seriously as they treat our physical health, and understand that they go hand in hand, and that really is a support that we need in our age group specifically.
It's just been fantastic to speak to you. Many people watching this will already be working in cancer centres, in cancer teams, or they'll be family members or current or former patients. They're not in places that are being built now or furnished now. Any thoughts to them about what they can do to improve wherever they are, to improve the experience for patients and family, particularly the young? Any comments you'd like to give them, messages you'd like to give them?
I think the big thing is getting some young people in and hearing what they've got to say specifically about those spaces, making sure that they are family friendly, that there are nooks and areas that you can escape to and that it is open and everything like that as well. And knowing that for young people, we are going through a lot more. We do need a little bit more support around us as well. It's often, that transitional phase where our carers aren't just our parents anymore. They can often be our peers or our partners as well, and understanding that there is a big differentiation there and allowing that support on all levels, I think as well, having specific support that is specific to our age group is really, really important.
Just an absolute pleasure to speak to you, and I wish you well. I reach out across cyberspace to you. Thank you for talking to us.
Thanks, Julie.
And I'd just like to thank the Peter MacCallum Cancer Centre for all the help and access they gave us in the middle of a pandemic, everybody wearing masks, and also to acknowledge we had a couple of images there that were from the paediatric area that were just put in because we love them too. Look, ladies and gentlemen, it's my pleasure now to welcome back Professor Phyllis Butow from the University of Sydney and Associate Professor Sandra Turner, radiation oncologist, Crown Princess Mary Cancer Centre, because they've been monitoring your comments in the chat. And if you haven't written in chat yet, put your thoughts on how to improve the radiation experience for patients and family right now in that chat, because it's a live consultation. But Phyllis Butow, if I could come to you first, some trends or observations on the comments you're getting in the chat from our audience today.
A couple of issues that are interesting coming up. One person mentioned that there'll be a really important role for navigators for the Bragg Centre to make sure that people know exactly where they're coming from and going to, and how they will go back to their original treatment centre, and how those connections will be made. Another person also commented, what about allied health? A thought that was close to my heart. And I think we perhaps have been lacking conversation about the role of some of the allied health, such as psychologists, that can play a role in radiation therapy. We know that anxiety is a huge issue for people, particularly when they're going through having the mask on. And our psychosocial experts can provide support that's effective. And even though many people can manage that on their own with a bit of support and also help from the radiation therapists, having psychosocial staff to support the staff as well as patients can be really critical. So I think that's a really good comment. And another person also noted that in thinking about proton therapy, which is sort of the buzzword, we need to also consider the negatives. Are there side effects, or what should we know about the negatives, as well as the promise that it holds for minimising side effects. So they were a couple of the comments that I noticed.
Thank you, and I'll just say that next week at this time, Wednesday, we will be speaking to an occupational therapist, a speech pathologist and a radiation therapist doing great work at Princess Alexandra in Brisbane. So follow our series and I promise you we'll have multidisciplinary representation. Let me come to Sandra Turner now, radiation oncologist. Just some quick comments from you of what's coming through from the audience, Sandra.
Well, there's lots of praise coming through from the audience about how valuable this has been. So that's the first thing. I think just maybe a bit more of a technical point leading on from what Phyllis said about concerns about proton therapy and whether, as it's so highly focused and targeted, does that mean it could miss cancer that's more spread or diverse or dispersed? And I think this is where we need to be very clear about the way we educate the community and other health professionals, as Morten explained, about what protons may or may not offer compared to, we call it conventional radiation therapy, but modern radiation therapy is super targeted and focused. So it's important that we don't lose sight of that, and we make sure we're clear with our messaging, because of whatever therapy we use, the priority will be to kill the cancer cells and not miss it. And then protons may have an additional benefit in some specific situations where we might be able to reduce the dose, particularly to very sensitive or growing tissues.
Look, thank you very much, Sandra. And I just want to say we did choose to focus on the experience in this set of webinars, but there is, of course, a hunger in the community in Australia and New Zealand to learn more about proton therapy itself, and we've taken that on board, and I will take that back to SAHMRI and the Australian Bragg Centre as we plan our webinars. I'd like to welcome now Associate Professor Peter Garaski, a radiation oncologist at the Royal Adelaide Hospital. Peter, unfortunately our time is so short, but 2 or 3 things that have really stuck in your mind from what you've seen today that you think are of value.
Look, I've just been absolutely amazed at the quality of the opinions that are coming through. I want to sort of touch on a couple of comments that Dr. Hoyer mentioned, which is really the importance of early design of systems, both the infrastructure and the human factors that go into making sure that the service is equitable and modern and fit for purpose for all patients that may derive a benefit from proton therapy. I can actually talk confidently that this, many of the aspects that he touched on, including a distributed ownership model, the development of registries, the use of comparative photon versus proton services, are already happening in Australia. And so there's multidisciplinary and collaborative efforts across the country to make sure that that is happening. We've been also, as a radiation oncology community in association with allied health organisations, already held 3 national particle therapy symposia, with another 4th one on the way just in a month's time, being hosted by our colleagues at Peter Mac. So a lot of those things that he touched on are front and centre of our efforts here at SAHMRI and also across the country. The other thing I want to mention, Julie, is I was particularly impressed by what Jess said insofar as the patient voice and how central it is in the design of the environment within the Bragg Centre. And I want to draw attention to the critical need of mental health support as the second of those 2 mission statements that she touched on, and the services that are required to make sure that patients do access those services during and well after treatment. And lastly, the recognition of the unique needs of the LGBTQ+ community in Australia.
Look, thank you so much, Peter. And I'd like to welcome Deb Page, who's the Commissioning Manager at the Australian Bragg Centre. I don't have time, Deb, to get you to explain your role, but I know I want to acknowledge that Deb has been absolutely fundamental to the planning of these webinars, and we are intending to do a complete webinar as one of our 4 in 2021 on the needs of Aboriginal and Torres Strait Islander people who have some very high levels of cancer impact. But Deb, watching what you've seen, the 2 things that are really sticking out for you.
Thanks, Julie. Yes, 2 or 3 things that really stuck out for me from Aarhus, Danish Proton Therapy Centre, and Peter Mac were how they thought beyond the clinical aspects, that they thought about the ambience, I think, as you've referred to it, Julie, and personality of the centre, which is what my colleague refers to it as, and how they can marry these 2 just to make it so much better for the patients, and how the patient experience is as important as the clinical treatment. So both of those centres have done just such a fantastic job at thinking a bit more holistically. And also the wraparound services, so the school, the transport, the accommodation. Next week we're going to hear a bit more about, activities outside of the Proton Therapy Centre. So just thinking a bit more about the entire patient journey and for patients and families. And then, of course, having the patient voice front and centre. We can best plan what we think people want, but, hearing consistently from Ilana, Morten and Jess about the nooks and the breakaway spaces when it just all becomes a bit overwhelming.
And I'd just like to say too, I have become aware in developing this series with you, Deb, that there is a lot happening in the irradiation oncology community in preparation for the arrival of proton therapy in Australia. But I think the engagement with the perhaps the patient and family community could be lifted up, intensified, so that we start attending some of the symposiums and the conversations. I know there has been some of that work, but perhaps we can heighten that further. But look, we don't have a great deal of time left, so let me invite now Thomas Masulo and Rosina Di Maria may also be with us. These are two people working with Woods Bagot, a company of architects and others who are working on the new Australian Bragg Centre. Can you join us, please, and tell us what has struck you and what you've viewed? G'day to you, Thomas, and hello, Rosina. So what have you seen? A couple of things each. You think, gee, that's thought-provoking, because you got the job of doing this thing.
We have, and thank you everyone for sharing your time and your personal experiences, and we really, really appreciate your input. And, I think from our point of view, when we first started this project, it was really quite interesting because we're developing the centre as we speak. So what I've heard is, everything that we've been talking about, which has been our starting point, and we've always had this philosophy of prospect and refuge. And I think that comes to play in what I've been hearing here in terms of there's places to retreat, there's places to be private, but there's also places where you want to come out and be engaged and be front and centre, be more public in what you're doing. So I think a lot of the conversations that we've been having around the patient centre experience and the human factor and that fingerprint, it's about me, and crafting everything around the individual is a really beautiful philosophy and something that we're looking forward to developing along this journey that we have, that we're all walking right now. But I also think we need to think about not only what happens within the centre, but what happens outside of the centre, because we know that the patient journey and experience doesn't happen at the threshold as soon as you walk in. It happens in my home before I leave, when I'm preparing. So whilst we're thinking and talking about all these things, what we're really interested in is the broader conversation, which is a little bit out of our control in terms of what we're being engaged to do, but it forms part of the story, and I think part of the success moving forward with any of these centres is what we've been seeing, whether it's around mental health, whether it's virtual realities, to demystify what's happening and to basically, I think, make the experience as friendly, accessible, and I suppose safe is a word that we heard a lot, both physically and mentally and emotionally, I think is something that we have definitely taken on board from today's speaker.
Look, thank you so much, Thomas, and I welcome Rosina, who's a principal with Woods Bagot as well. And if I could just say to you, we've already interviewed and we've got marvellous footage of the Christie in the United Kingdom, and we will be collecting footage of other cancer centres, and we will, while we may broadcast it in 2021, we will bring that straight to you before we broadcast it in 2021. Rosina, your thoughts, a couple of things you observe.
I think it's really important to understand beyond of what people are going to be experiencing in the space is to put ourselves in the eyes of the patient. And as an interior designer, that's my job, is to try to have an empathetic approach to the experience of those who will be using the space, from the approach to the building and how people feel. Do they feel safe? Do they feel like it's a place that they feel confident in attending, right to the front door where they have their first smell of the space, the acoustics and how that settles them, the wayfinding. And I think it was really important that intuitive wayfinding means that you feel safe and confident in the facility that you're in, right down to biophilia and how the introduction of nature into any environment really supports everybody universally in feeling confident in the spaces that they're in and connected to nature is actually a very calming effect. So we're really interested, and I've taken a lot of what you've all said, and it really encourages us because we've introduced all of those notions. We're taking the sort of the experience from a different point of view from every patient, age, demographic, as you said, Aboriginal and Torres Strait Islander. It's important for us to consider this from multiple cultures and backgrounds, but the linking factor that is the human experience and what we do when we respond to environment is the first step that we can support all of you as professionals in giving people the best treatment.
Rosina, I don't have time in this webinar, but if you and Thomas were able to join us again next week, we would be so grateful, and perhaps explore with you how open you are to this notion of working with a board of patients of different types and ages and backgrounds in real time. But I'll leave that for next time. Before we finish, ladies and gentlemen, I want to thank everybody who's been putting their comments in the chat. We will be sending you a survey, but I want to welcome Kath O'Loughlin from Childhood Cancer Association, which is based in Adelaide, who's been watching it all, and they support. Hello, Kath. You support children and their families, I know, across South Australia. Just in a couple of moments, I'm afraid, the 2 or 3 key things you're taking away from what you've seen today, you want all the professionals to be thinking about.
I think there's 2 things. The input from the patients and the families, particularly the comments that were made in Denmark and at Peter Mac, that it's just so important to have their input into the design. And what has, I guess, eventuated from that has been that a recognition that the needs of every family is so different and so unique. So to be able to incorporate the flexibility so that there are spaces where there's shared spaces, there's recognition that people need, quiet times, different types of accommodation, all of those sorts of things, I guess, are incredibly important. And the other thing, just briefly, I guess, is the acknowledgement of the importance of the wraparound services. What happens before a patient arrives, what happens after their treatment, looking after their mental health. Obviously, that's something that's really important to us, and it's great to see that that's been built into these new centres.
Kath, thank you so much. Kath O'Loughlin from Childhood Cancer Association, and we will be having a webinar that focuses comprehensively on the views of patient groups and advocacy groups. Well, ladies and gentlemen, thank you for joining us for our first webinar. Our next one is on Wednesday, the 25th of November at the same time, when we'll be visiting the Christie in the United Kingdom, in Manchester, and also Princess Alexandra Hospital in Brisbane. And remember, we are going to be sending you a survey, and we are going to set up a YouTube channel, so people who've missed us today will be able to see today's webinar and all the other webinars we do. You can subscribe and you get sent everything we do at a future date. So if you could all clap each other, thank you so much. That was a wonderful beginning for us. And thank you to SAHMRI and the Australian Bragg Centre.